Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from the HIMSS annual conference in Las Vegas, HIMSS21. It was not an easy road to get here, but many thanks to all of my guests that stuck with me and all of you to make this show happen. And it's great to be here with all of you and continue this trend for 7 years straight after my first broadcast live from HIMSS21 in Chicago. That was a phenomenal event and launched a great annual trend of key thought leaders sharing best practices and strategies to successfully navigate the future of healthcare. As many of you know, my goal for broadcasting live each year from the HIMSS annual conference is to create an information medium that shares best practices, strategies, and actionable intelligence from the industry's leading sources and experts. We're very fortunate that most of these guests are also members of the Health Innovation Think Tank, where we transparently share healthcare and health IT best practices as well as strategies. You can find out more about the think tank at healthinnovationthinktank.com. My goal, along with all my guests today, will be to offer tactics and strategies to not only survive, but to thrive as you navigate your hospital, your physician practice, your company, or even your family through all these changes occurring across healthcare. There's more opportunity than ever before for all of us to thrive, but we must understand how healthcare is evolving, how policy and reimbursement is shifting, and where best practices and innovation can support our efforts. So my next guest, Dr. Rasu Shrestha, Chief Strategy and Transformation Officer and Executive Vice President at Atrium Health. Welcome back to the show, my good friend.
Well, thank you. It's an absolute pleasure to be back.
First of all, how are you doing?
Well, thanks for asking. I'm doing all right. You know, there's just so much that we are doing here at Atrium Health and really across the industry. It is such an opportune time, especially for me, who's in charge of strategy and transformation. I think, you know, when you look at the pandemic and everything that we're going through right now, there isn't really a better opportunity to accelerate the pace of strategy and transformation than the one that we're in right now. So busy.
I love it. Actually, that's how I opened my show. That was, one of the components is I just think there's more opportunity to thrive, not just survive through all this, but to thrive through all this. There's so much evolution. And if you're on top of it, you've been a part of it, and you understand the mechanics. There's more opportunity than ever before, in my opinion. So I think that you feel
Absolutely.
The same way. Excellent.
That's right.
And also, the reason I love you is your boundless optimism. That's how John Halamka just closed his last segment. I said, "What are you parting words of wisdom?" And he said, "Boundless optimism." And that's always you and your mantra. So I look forward to this segment. So kind of diving in a little bit, what are some of the healthcare and health IT trends that you're seeing in the industry, Rasu?
Well, you know, the pandemic really has accentuated the existing cracks and the fault lines in how care is delivered and how, you know, the many inherent biases still exist in the what, the how, and the whys of healthcare. And if I could summarize it into what I call 5 global truths, these are the following, right? So one is that we are one global community. If there's one thing that the pandemic has opened our eyes to, it is that we are one global community. That this virus that, started out of Wuhan in China has essentially affected every one of us across the globe and beyond even, right? So when you think about, you know, all of the race and the space that we've been having right now, the pandemic's been top of mind for everyone. Number 2, the walls between medicine and public health have really come down. And I think that has specific implications in terms of how we continue to evolve. Number 3, the walls between health sciences and life sciences have really come down as well. So think about drug development, vaccine development, and all of the things that we need to do in terms of translational sciences as well. And then 4th is cloud, virtual, and AI. These are not just aspirational elements anymore. These are foundational must-have components that we have to embrace moving on forward. And then last but not least, not to throw this out there, but fee-for-service has really failed the test of the pandemic. Right. And I think we really need to rethink the business models of healthcare delivery all through and through.
I love it. I could not agree more. So balancing that, what are a couple of strategies, 2 or 3 strategies or best practices that you can share that you're, with my audience that you're using today to navigate?
I'll pick out 3. First is really around data and interoperability. The second, I'll talk to health equity and some of the things that we're doing around social impact. And then third, very quickly, burnout. And I think that's really important, especially given everything that we're living through right now. So very quickly, in terms of data and interoperability, the antidote to the massive distrust in information and some of the privacy concerns is not information blocking. It's open data, it's open APIs, and more open policies. So we're doing a lot of things here at Atrium Health to really push forward with making sure that the data flows much more freely in the domains that we're dealing with, from the silos that data oftentimes get locked in terms of the clinicians and their repositories and the EMRs, to the data domains that our patients and our consumers reside in, right? And it's not in the EMRs, it's in their devices, in their cell phones, in patient-entered data, but also in their personal preferences and in the circle of trust that they have. So lots of things that need to happen to really push forward with this. I call it the crawl, walk, run journey of interoperability. And I think we have the opportunity to really run and perhaps to even fly if we're able to embrace the notion of open APIs. And specific to health equity, there's just so many things that we've really doubled down on here at Atrium Health. Our mission is health, hope, and healing for all. And the for all part of that mission statement, has really been something that we've been living up to throughout the pandemic and more. We organized what we call our community immunity for all, a number of specific things that we've been doing in terms of the vaccine hesitancy and the apathy that really exists out there, leveraging the power of data and analytics to really drive forward with things like the COVID-19 vaccine demographic electronic dashboard, the things that we're doing around geospatial information technology and how we're then impacting the specifics of the communities that we're serving, even in the mass vaccination efforts that we've been leading, really abjectly focused in on the underserved. And 21% of those vaccinated in a number of our mass vaccination efforts were from underserved populations, and overall 127% improvement in the number of Black and African Americans, and overall a 212% improvement in the number of Hispanics and Latinos that were targeted. So very, very much a data-centered effort. And then, last but not least is really burnout. And we could go on talking about this forever, but, burnout, I think, is really an important issue for us to address head on, taking a much more structured, a system-wide, aligned approach with dedicated resources that are more sort of top-down, but also bottoms-up in terms of the continuous data-driven analytical approach to burnout and this notion of resilience. How do we make this the best place to care? And that's a big effort that we've really been leading across the enterprise here at Atrium.
So just on, because I know burnout is significant, and we've been hearing this for years. Do you have like a strike team, or do you have a philosophy, or how do you tackle that for an organization of your magnitude?
All of that and more. So I think really essential for us to identify and address the specific problematic workflows, and we have to leverage technology to reduce the friction and the frustration, which is the major cause of burnout. We're all motivated to care for our patients, but at the same time, the passion that I came to healthcare with, as a clinician, that oftentimes gets dwindled as a result of the technology challenges, the do more with less mentalities, and the misalignment in terms of the incentives. And so I think it's really important for us to make sure that we have a much more analytical and a much more aligned approach to target the very root causes of the burnout in the first place.
Excellent. So looking forward, in the next couple of years, I know we have a lot right before us the next 3 to 6 to 8 to 12 months, but thinking ahead a little bit of where the puck's going to be in healthcare and health IT, what should we keep an eye out for, or what are you looking forward to, or what are your thoughts there on what we should navigate in the future?
It's a great question, and I'm right on the verge of essentially working through with my team on our 2025 strategy.
Love it.
And when I think about, where's the puck's going, and how do we make sure that we're able to not just be reactive, but proactive? The one thing that really comes to mind is that healthcare is hard. Everyone wants to fix healthcare. But healthcare, as we know, is mired in complexity. It is deeply personal. The economics don't really work. The incentives are not really aligned. And change is always hard given the embrace of the status quo. So I think the one thing that we really have to do is to understand the notion that healthcare is rapidly moving from the supply-driven, provider-centric environment to more of a consumer-centric, demand-driven environment. That this pace of change that we're navigating right now really calls for more of the ecosystems of care to maximize the value that we really need to push forward with. And we need to make sure as health systems that we are the conveners to orchestrate this comprehensive health delivery mandate, really looking at all of the different elements of the social determinants of healthcare, the population health, but also the precision medicine elements of what it means to really personalize the care to that N of one. And then last but not least, just to put it out there, I think, as we're living through this pandemic, the one other thing that I'm really, paying close attention to is the talent war and how, the work environment that is rapidly changing in front of our very eyes, as well as the demands that I talked about in terms of the consumers and the pull that we're seeing from our patients. I think that's really going to have a dramatic effect in how we retain talent, how we recruit talent, and how we really incentivize our workforce to continue to really excel at the top of their license and beyond.
A lot of wisdom there, Rasu. I just had that conversation with people yesterday, and actually over the last 2 days. Just our talent pool and the stress that we're putting on the employees. There's a lot happening behind that, and so I'm glad that you brought that up because that was a side conversation that I had that I've never spoken about on air because it's something actually fast evolving in the market and the communities and in our health systems and just all of our companies even today. So I'm glad you brought that up and thank you for that. So obviously you're always a phenomenal guest, my friend. Thank you for joining this show.
Well, thank you very much.
All right. I'll talk to you soon.
Take care.
Take care, everybody.
Right,
bye-bye.
bye.
Paul, welcome to the show, my friend.
Thank you very much. It's great to be here.
So you're a first-time guest, so grateful for you taking the time to join us. Starting there.
Well, thank you very much.
You got it. So tell me a little bit about your thoughts and what healthcare, digital health trends that you're seeing in the industry from your perspective.
Well, of course, since we're still in the middle of the COVID pandemic, telehealth and virtual care definitely come to mind. We saw kind of a panic adoption of telehealth going from, at least across the Athena network, less than 2.2% of all visits on telehealth to like 35% back in April of last year. Things have settled down quite a bit. It's now about 7% or so of all visits are telehealth. And I think people are taking stock and saying, hey, this is actually a new tool. It's a new way of engaging patients. We're seeing more visits after hours and getting rid of the waiting room has been awesome. So a lot of cool stuff there. Somewhat related, I think we're seeing better infection control in general. COVID isn't the first viral illness that people have when they go to the doctor, and people are still wearing masks and rethinking the kind of hygiene around the physical office when people come in, which I think is going to bode well for the future going forward. Then lastly, value-based care is still here and continuing to increase. And I think as we got through the COVID crisis, there's a lot of people on value-based care contracts that spend a lot of time making sure that their high-risk patients were getting in and getting the preventative care that they need. And just seeing a lot of great trends around remote patient monitoring and care management in that space.
Excellent insight there. So you're spot on, Paul. So what are a couple, maybe 2 or 3 best practices or strategies that you can share with my audience to help navigate some of those trends that you just talked about?
Well, certainly on the telehealth side, everyone pretty much just implemented telehealth, immediately and in a panic and hey, just replace the schedule with telehealth visits instead of physical visits, which isn't really the way to think about that tool. And so I think now that things have calmed down, what we're seeing is people really looking at telehealth and figuring out how it really fits into their practice for their patients. We're seeing a lot of after-hours visits. We're seeing shorter visits, kind of indicating that these are kind of work-in visits, often booked, same day or day before. So it's becoming more of the convenience tool, I think, that we all hoped it would be, and obviously appropriately augmented with physical visits. The other thing that's been very cool is that we also demonstrated that we could do things really quickly in terms of adopting technology.
Right.
We've changed our release philosophy a little bit at Athena. We are a SaaS-based software, so we can release literally every day. But we've been reluctant to do that because we don't want to impose lots of change on our clients. Every week it's a new way to use Athena. So change is good, but that's too much. But we've learned a lot about how we can appropriately put out changes that aren't disruptive. We had to do it a lot during COVID because the world was changing so fast. Telehealth reimbursement was changing. We just needed to get the order sets and the clinical content around COVID out. And we've really opened the aperture a little bit in terms of how we can drive change and help our clients change in a structured but thoughtful way.
Yeah, I couldn't agree more. And I think the importance of telehealth, and like you brought up, we fast forwarded it about 5 years or so inside a lot of our care strategies. And that's really important. A lot of us have talked about the importance of telehealth. It's not telehealth as a component for episodic care. It's actually how to integrate telehealth into a care strategy for a practice or a health system or a health organization, whatever it is. What telehealth can do, what those visits can do. Obviously, can be much quicker. Can actually help triage care where it needs to be. Can give care where into communities to improve access. There's so many components that just were not brought forward. We knew the importance. I mean, you've been in the industry for a long time. You knew the importance of telehealth, but just people weren't incorporating it. And there's a lot of reasons why. But COVID brought all that forward for us. And so I think that's a great opportunity for us to mature our care models and really understand and respect, what telehealth can do, virtual care, where it's important, where it's not important, and then what's also where in-person care is critical. And then also what we can leverage and manage virtually and via telehealth or telecare type appointment. So I completely agree with you. So I'm thinking a little bit moving forward over the next 2 to 3 years, and from your perspective as a thought leader, but even Athena's and their strategies, what should we be thinking about in 2 to 3 years from now? I know a lot of us we're just worried about getting through the day. We have really crazy busy days, but putting in that crystal ball a little bit, or what do you hope for, or what do you think you're going to navigate it again as a thought leader as a company in 2 to 3 years from now?
Yeah, no, I definitely feel you on the getting through the day and dealing with the crisis du jour.
Exactly.
But it certainly as we look ahead in our space, we see a big opportunity to make the EHR smart. In some levels, we rushed EHR adoption through when meaningful use came out. There was a big rush to adopt EHRs, and I think we're now in that phase where it's settling in. We're understanding the pros and the cons, and where EHRs have really made a big difference and where there's still some opportunities. I think one of the big ones is to make the EHR smart, to really understand the context of what's happening. So understand all the patient information, not just know that there's a vital over there to put on the screen, but really understand what that vital means. And to understand the context of the patient. What's the well visit? Is this a post-op wound check? Is this a pre-op visit? Is this a sick visit? What's the nature of the visit? What's the nature of the specialist? And then the EHR workflows can start to become much more delightful for the physician, much more intuitive, much less redundant asking of questions, right. Much less presentation, frankly, of irrelevant data. So I really think we're going to see a big revolution in that over the coming years. And somewhat related to that is I think the full expression of consumerism in terms of digital engagement with the health system. Telehealth has kind of forced that a little bit. But, if you looked before COVID, the kind of median encounter out there in the world looked a lot like 1990.
Right.
People are calling in for appointments. People are getting paper requisitions and going to labs. And, I think the fact that we now couldn't contact each other, so we couldn't hand over paper so easily, forced us to get more virtual. I think patients are more and more demanding that digital engagement that they're experiencing in the rest of their lives in the healthcare space. And that's just going to do so many good things to some of the stuff you're talking about in terms of value-based care and patient engagement and taking care of patients outside of the context of the visitor.
It's excellent. And I completely agree with you on the smarter EHR. And that's how actually Rasu closed his session with me a few moments ago, is just around physician burnout and the need that we need more intelligent systems. We need to really continue to always, figure out those workflows, make those workflows better for providers and for all staff, part of our health ecosystems. And certainly, as you know, consumerism and then for the patients. But we really, and I know this is a focus for Athena, and I know that, really making that life better for the physician, managing that physician burnout, and just staying ahead of that. So I applaud you. I know you guys actually done some great work, even, leading into HIMSS, talking about your focus there. I know you're on point there. So any words of, parting wisdom? Even I think one of the questions I've left a couple of my guests with is just, as a thought leader, with this Delta variant and how we should be thinking about, even as leaders of our companies or leaders of our communities and leaders in healthcare, and even our families, any parting words around on what we can do in the next 3 to 6 months to be as successful as possible?
Well, I think the dialogue on COVID is shifting from, trying to eradicate it or make it go away to try to figure out how to live with it.
Yes.
And I think there's a lot of work going around making sure that we've got everyone access to vaccines that's willing to take them and helping provide education there. Thinking about best practices as we learn more about how this virus is transmitted. To think, if we could learn more about what are the settings where this occurs, we can then take preventative action that's more targeted. Some of the things that are going on are very broad brush, just because we don't really understand the modalities of where is the virus, where is it most likely to be transmitted, and therefore how do we take precautions. So I'm super excited to see us learn, because I think it's also going to benefit for other viral illnesses that we have today and that we'll have in the future. So hopefully this is a great opportunity for us as a society to learn and behave intelligently and thoughtfully and learn to live with this situation that I think is going to be with us for a while.
Yeah, great advice, Paul. Thank you. Well, hey, I know you took time out of your vacation to join us, so thank you for that. Grateful to have you on the show.
Awesome. Well, thank you so much, and best of luck, and sorry I'm not down on the show floor with you.
No problem. We'll see you next year. Take care, my friend. And now my next and final guest, Dr. Monica Bolbjerg. Great to see you again. How are you?
Thank you. I'm great.
Awesome. Dr. Bolbjerg, I'm great. Founder and CEO of Cure for You, certainly, and also my business partner at Cure for You. So she's a great colleague, but also friend and longtime thought leader in the industry. We first met through my think tank, and you always have a great consumerism voice, and almost every single guest today has spoken about the importance of consumerism. And I did not really plan that you to be my final guest and kind of back cleanup for that topic, but it just everything always works out well. So first of all, the show been great for you?
It has been awesome. Yes.
Yeah. HIMSS, someone asked me this morning, how's your HIMSS going? And I said, and actually it was Rasu. It was actually last night. I was closing my day, just getting ready for today. And he's like, how's the conference? I said, HIMSS is what you make it. It's you can get out there, you can shake a lot of hands, or elbow bumps as we're doing here to be safe, COVID safe in most cases. But it's what you make it. And it's been a phenomenal show. A lot of our meetings have been all preset and everybody's showing up. So what are some of the healthcare and health IT trends that you're seeing in the industry, Monica?
Well, we've been talking about consumerism for a long time, but I think what is happening now in the industry is that it's actually, people are talking about consumerism and digital health as a strategy, which is really what is changing now.
Yes.
So it's not something like, interesting, what could that be? People really sit down and think about what does that mean for my organization? How can I better help my patients? And how can I leverage consumerism? Because everybody knows it's here to stay now.
Yeah. So what are a few best practices that you offer as a thought leader yourself or through Cure for You, to share to navigate those trends?
I think the most important here is to not forget the provider when you talk about consumerism.
It's excellent.
Because at the end of the day, if we don't help the provider get better,
that's right,
we never get the patient better. So, and really to get there, you need to think about having platform instead of point solution. You need to think about integrations and automation so that the provider and staff can keep on working in their current environment and leveraging technology to get the data out to the patients and the data back again that the provider needs.
It's excellent. And Rasu mentioned that, just to the importance of the physician health, and you just led off with that. And don't forget the provider, because they're the linchpin in that component. And in all this consumerism that's happening, we got to make sure that we're creating the workflows. And everybody keeps bringing up, all guests, API integration, and the patient, and making sure that this data is flowing. And then we're also, keeping provider part of this process. So, your advice is spot on. What are some of the other best practices that you're working on at Cure for You to offer out, or even as a thought leader? Because I know you're doing a lot of public speaking. Yeah. But what even or some of your messaging here at HIMSS, because obviously these large health systems that are here. What are some of the best practices that you're sharing with those larger health systems and organizations?
Well, I think if you really want to embrace consumerism, you can get a lot of positive things out of it for your organization. But think of it as a platform strategy. Think about owning the data. Think about how you now can, with one or maybe two solutions instead of 10 and 15 solutions, really it makes it possible for the large organizations actually to manage these things, because having 10, 15 solutions is not manageable at all.
Right.
So another thing that I think is really important is somehow the support for staff and patients, because this is still new. There are new workflows. How do you do that? And one thing that we've seen is really efficient is to provide the patient support. That helps our customers immensely. So because we can help them kick it off and so on, and they can focus on their internal providers and staff.
That's an excellent point. Actually, Rasu brought that up about, your thoughts on platform, because they're looking for ways, and I know this is near and dear to your heart, of just making that your physician yourself and making that physician workflow much better, and being able to collapse multiple different products or functionalities onto a single platform. And that's a big, I've seen that messaging here, but I know that you've been advocating that for, many years, decades at this point.
Yeah. But I also think it's like, think about automating workflows with protocols. And think about how you can individualize care for the patients by providing the right amount of data to the physician and vice versa to the patient as well, to motivate patients. People think that you give them a home monitoring device home and they'll be healthy tomorrow.
Right.
I mean, these people have been with these
chronically ill for a long time.
Very long time. And there's more. So I think the other trend that is really happening is that it's not one thing, it's multiple patient-facing solutions working in tandem, like after each other. And you can kind of use telehealth with secure messaging, with remote monitoring, with the check-in. Now the patient needs to come in.
Right.
So.
Yeah, I've heard, I was at a dinner last night, one of the RPM vendors just talked about, it's how easy it is. It's just a box. They open up this box and just plug it into the wall and everything's great and works. I'm like, no. Because there's investors at the table as well. And so I know he was doing a product pitch, but that's not the way this works.
No.
So.
We've done remote monitoring for more than 10 years now. Yeah. There's much more to it, and the industry is still very young.
Yeah.
And so we have to, as an industry, figure out how we use these devices. They're here to stay, but how? How is it going to work best? Is it long-term remote monitoring or is it short-term? Is it sending patients home with 2 or 3 months instead of like thinking about it something they have to do for years and years?
Right. Excellent advice. So now, and again, I always couch this because I want to look ahead, but I know we also have busy days. We're just, we're doing everything we can just get through today and tomorrow, and lead our companies and businesses. But what's a key strategy or trend that we must be ready for in 2 to 3 years from now? Kind of thinking ahead a little bit.
I think we must be prepared for digital health at scale.
Oh, yes.
So, because we saw what happened with COVID and how fast we needed to adapt to telehealth.
You got it.
Overnight. And everybody was like, kind of like, oh, that was not fun. And so I think last year people actually thought a little bit about that. But I think that a lot of people forgot it again.
I agree with you.
And so I think everybody needs to kind of think about scale, because patients will adopt these tools and they will adopt them really fast. So don't think about doing remote monitoring for 100 or 200. Think about the technologies you embrace can actually take care of
thousands and thousands
of patients.
Yes, right.
I think that's one thing. And the other thing is we got to figure out how we work with the data.
Yep.
What data makes sense?
Yes.
There's so much now that when you have data from patients when they're at home all the time monitoring.
Yep.
Right? But I think there are great ways to look at that, where you can actually also figure out who needs help when, instead of treating every patient the same way.
Right.
So we'll probably get to really individualized treatment, like we've talked about for many years, but in another way.
Yeah, and that brings up the importance that you just brought up about the platform. It's not about a silo piece of information. It's about the full platform, looking at that data holistically and not having, as John brought up, alert fatigue, data fatigue, to your point.
Yeah.
I completely agree. So, no, that's excellent. And again, that supports your concept around the whole platform to really understand where does data needs to go, who sees it, how do they see it, and then there's a managed process to that. It's not just data flying everywhere. Because it's starting to move, but you need the right data at the right time.
Exactly.
So to provide the right care. So, cool. Well, Dr. Bolbjerg, thank you so much for joining me. You've been a great guest through the years, and I hope you have a great rest of your conference.
Thank you so much for having me.
You got it. Thank you. And just thank you for everyone joining us today. And please tune in weekdays at 2:30 p.m. Eastern, 11:30 a.m. Pacific. As always, you can track me on Twitter at HIT Advisor and use the hashtag ThisJustinRadio, and you can respond to your comments from the show. If you missed any of this broadcast or want to hear more, my shows are always posted at Apple iTunes, SoundCloud, iHeartRadio, Spreaker, Google Play, and TuneIn. So thanks, everyone. What a great HIMSS21, and I hope you have a great rest of your week. Thanks so much. Thanks, Greg. Thanks, Roberta.